Welcome to our COVID-19 special edition right here on Facebook Live. Our fearless leader, Meg Major, is off. Today, it's all about how retail dietitians are taking the lead in store and in the boardroom. Our special guest is Annette Maggi, Executive Director of the Retail Dietitians Business Alliance. Full disclosure, I wear two hats as I'm also the CEO of RDBA. We have with us our normal team, Jenn in Denver, Kat in Chicago, and John in New York. Let's get started. First up, John, tell us about the changes that are taking place at Sprouts.
Yeah, thanks, Bill. Sprouts Farmers Markets announced their quarterly earnings, and typical of a lot of the grocers, the numbers were really good. Particularly in Sprouts' case on the profit line, their margins up 36%. Jack's talked about making smaller stores more productive, things, pulling back from the promotional strategies that they had done, which was mainly commodity price investment on produce, and instead targeting things toward particular groups of shoppers that they find attractive. And what was interesting in it, aside from the good numbers, was that some of the trends that we've seen kind of building up in this COVID crisis that have accompanied this are going to support the kind of growth going forward. Healthier eating for one thing, fewer things in the stores. So Sprouts are going to, they're going to shrink their stores by 20%. How are they going to make room for that? Well, they're going to have to dial back bulk. They're going to have to dial back salad bars. They're going to, they've got these massive delis in the new stores. They're going to shrink that down a little bit. And kind of talk about that. The financial analysts love to hear the profit lines, and they were pretty encouraged with their, with what they had to say. Their stock's up at a 52-week high this morning. So that's what's going on at Sprouts. A little bit of a, some people have described as a Trader Joe's for natural organic eaters.
So, John, what about store expansion? Did he share anything about store expansion? How many Sprouts, does he want to have?
Yeah, they talked about 10% store growth year over year, each year. So based on, 344 stores that they've got now, that'd be somewhere in the neighborhood of 30, 35 a year. And, the other interesting part of that is that the stores aren't going to spread out quite as quickly or as widely as they once had, because one of the, efficiency aspects of the plan is to have no stores any more than 250 miles from their fresh food distribution points. So that means most likely more stores around Florida, around Texas, around California. And he also mentioned the mid-Atlantic states where they've only got a few stores and they don't have that distribution yet. But you can imagine that that's coming. They're building new distribution centers in Colorado and in Florida. And it can also mean that some of the places where they have built stores might not stick around for a long time. There, for example, the Pacific Northwest, where they've only got a couple of stores and are many hundreds of miles from where they can get fresh produce to them quickly and cheaply.
So, Jen, are you excited that you're going to have a Sprouts in Denver?
we already have several. Yes, that's great.
But with the new distribution part, John, in Colorado, do you think that they're really going to expand in Denver and really challenge some of the retailers that are up there now?
Yeah, well, Phil, they're there already, and I think that what they were saying was, so they're in Texas already, they're in California already, of course, they're in Florida already. But what they want to do is support places where they've got density and a place, and room to grow. But, rather than, dragging your produce from Southern California to Denver or from Texas to Denver, or however they're doing it now, they're going to get something closer into those markets. And then that's going to support both local marketing, they say, but also save a lot of transportation costs.
So, Kat, what's interesting to me and disturbing to me, as my grandfather was a dairy farmer, are all these stories about all these dairies having to dump milk. What's going on there, and what's the solution?
Yeah, so I mean, Dairy has been kind of an interesting situation, as a lot of consumers, when they go to the supermarket, maybe haven't had the selection they had before in dairy, as it's been one of those items that people are purchasing a lot of. And at the same time, media is reporting stories about dairies dumping gallons and gallons and gallons of milk. The issue is that have the situation, schools, food service are out. That means a lot of people are out of work too. So food banks are seeing a huge surge in people coming to them needing help. So the retailers are stepping in, they're purchasing that milk, and in Publix's case, it's produce as well, purchasing it from the farmers and then donating it to the food banks. So it's trying to, have that stopgap, so we're not wasting food and we're actually getting it to the people that need it. So, hopefully this is something that will continue as we slowly start to recover. So, and I think it's just a great way for the retailers to show that they're out there to support their communities, they're out there to support the farmers, and to, help the food insecure among us.
And what's been, the reaction from shoppers? Do you have any insight on that? I mean, are shoppers that are going to Publix, giving kudos to Publix for doing this, or it's basically invisible behind the scenes?
I don't really know how much uh, mainstream press is out there on that. But obviously, if they're doing any kind of campaign to acknowledge this, then I think most consumers would be very proud that they are shopping at a store that is stepping up to the plate and donating so much food and funds. They're also donating some money too. So
That's great. So let's move in store and let's talk about the role of retail dietitians. Annette is with us, as I introduced her before. Annette, how important of a role are retail dietitians playing during COVID-19?
Yeah, thanks, Phil. I mean, I think this is an opportunity where retail dietitians are really showcasing their skills. I think there's two things that we're seeing some significant impact given the coronavirus pandemic. First of all, I'd say that, we all know that the science has been evolving and that it changes week to week a little bit, and that frankly, the CDC recommendations are very factual, but they're a little bit dry. So we're seeing really C-suites of retailers relying on their dietitians to help them navigate the science, but also to help them figure out how do we communicate this to our shopper. I'd say the other area where we're really seeing retail dietitians have impact is in their ability to pivot from, traditionally being in store doing promotions and store tours and engaging with the shoppers to now having to do that all through social and digital. But they're addressing topics that families care about right now of, everybody's home 3 meals a day. How do you do bulk cooking? How do you cook from pantry staples? But also addressing topics that are flipping in the media. 2 weeks ago when suddenly everyone was talking about washing your produce with bleach and detergent, which is not the recommendations, those retail dietitians took that opportunity to work with marketing and communications and say, how do we really get the right information out to our shoppers so that they're keeping their families safe?
So a question to Jenn and Kat and John. In your areas of Denver, Chicago, and New York, what are you seeing from retail dietitians in the stores that you're going in? Are they actively out there and talking to consumers? What about what Annette just talked about with social media? What have you all observed?
I've seen more of nothing in store. I think people are so sensitive about social distancing that I think most of the outreach has been, virtual, with retailers offering virtual, access to a virtual retail dietitian, that kind of thing. Tips for,
healthy eating tips sent via, Facebook or social media, that kind of thing, that virtual outreach.
And Kat in Chicago?
Yeah, I think a lot of it obviously has to be done virtually right now. People aren't spending a lot of time in stores like they used to. Just being able to reach out, whether it's, like Hy-Vee does things with their dietitians online where they, show how to put a meal together using, some prepared items, some, made from scratch items. So it's things like that, I think, where they're really starting to kind of pivot and use their social platforms in order to keep that connection going.
John, how do you think that the role of the retail dietitian will change after COVID-19?
It's a good guess. I'm probably not the right guy to answer this one, but I mean, you could imagine just as an observer to the industry, right? Because I don't happen to shop at any places that employ them, at least obviously here. We're walking to our stores, here in the city, just small stores. But obviously the opportunity is big for that aspect of the industry, right? There's been as Annette mentioned earlier, there's questions about how to help to handle food safely. There's obviously a big opportunity here to really get people to get comfortable getting back into the stores, because you hear a lot about this idea that maybe grocery shopping is not going to come back or stay as strong as it will once things get going again, because people are a little bit concerned about it. Those kinds of things that are going to matter, big, whether you're shopping online or you're shopping virtually, or even at the store. So big opportunity to communicate with customers and get a message out to them. Our store is safe to buy, shop. Here are the things that we can help you with.
So,
go ahead.
Can I add one thing just about what Jen said? And Jen, you brought up the whole virtual piece, right? And I was actually on a call this morning with Stacy Bates, who runs the Retail Dietitian program at HEB. And there were two things she talked about related to virtual that I think are really interesting. I think, first of all, she indicated that, their dietitians do telehealth consults, which is really important for that shopper who is managing heart disease, is managing diabetes, and needs that continual support. But the other thing she said that she sees as an evolving opportunity for the dietitians at retail is, everybody's been cooped up, stress is high. There's a lot of mental health issues now emerging. And how do you really start to integrate kind of mood and mental health into the services that dietitians at retail offer? And she sees that as an emerging opportunity.
And Annette, how does she see that opportunity manifesting?
Well, I think it's about really, and she sees it as more coaching about total lifestyle and how do you help people understand all the factors that impact mood and life satisfaction and all of those kinds of things, and stress management, that sleep, meditation, mindfulness, all of those kinds of things will now be kind of incorporated into nutrition guidance and healthy eating options in the store. And how do you bring it all together?
To John's point that we're going to have a consumer base that might be fearful to go into a supermarket, do you see that retail dietitians are going to be much more virtual, that they might not have their offices, they might not be doing in-store consultation, but it might be, to a broader audience using technology?
Yeah, and I think, John, you're right. I think that the consumer will lead on that front and the shopper will lead and what their comfort level is, right? I mean, I think the idea of group classes for healthy cooking that dietitians have historically done will maybe go more the way of what we've seen on the cooking channels of buy the ingredients and then join me at this time and we'll prepare this item together, right? It'll just be a focus more on healthy up.
So what impact does that have?
I think that retail dietitians are being very inventive right now.
Yeah. So what impact does that have on the role of the retail dietitian? Does it increase it? Does it diminish it in that whole corporate strategy?
Yeah, I mean, my guess, Phil, is actually that we're going to see strengthening of retail dietitian programs because And John, I think you mentioned that health and wellness is not going away, right? I think there's heightened interest by the consumer in health and wellness, but I also think food safety is going to continue for months to be a priority to the shopper. And that's an area where retail dietitians are knowledgeable, but they're also really good at communications. And so they have that platform, they're trusted by shoppers. And so we'll see that continue to drive. So I think it's actually going to strengthen, and we're going to see even stronger retail dietitian programs and services evolving out of this.
What and a question for everybody: what challenges do you see for retail dietitians in the future and currently? Jen, why don't we start with you?
Well, I think that the not being able to kind of meet face to face is a challenge. But as Annette said, I mean, I think the virtual aspect, the cooking classes and the even one-on-one, meetings with customers virtually is really going to surge in these times. And I mean, retail dietitians have never been more important in terms of linking the community together, in terms of helping people immune boost, mood boost, the whole lifestyle package that Annette's talking about, and they can really be a resource during these difficult times.
Kat, you see any challenges?
I mean, I think much like Jen and Annette have pointed out, it's going to be that personal component. Dietitians, I think, we're very used to working one-on-one or in small groups with people and being able to develop that personal relationship, which can be a little bit more difficult on a digital type platform. And I also think that it might be harder for the stores to get the word out to say, hey, we still have our dietitians, when they might not necessarily be in store and you can walk by as they're conducting a class or whatever. So I think there might be a challenge on the retailer side to say, we still have this resource for you to use.
So, John, when we look at everything that retailers have gone through and all the added cost, the plexiglass, the sanitation, the one-way arrows that nobody's paying attention to, and so on, is there going to be pushback from retailers to supply this service of counseling through a retail dietitian, or is it going to become more important in your mind?
Well, I mean, I probably wouldn't recommend put them cutting back on it. When I was thinking, when you asked about challenges, was that one of the sort of foundational issues that the COVID's brought up is this idea of more and more shopping going online. And, a company like Sprouts, that we mentioned earlier, was seeing 13% of their sales in the month of April being conducted online versus probably less than 1% a year ago. Mm-hmm. So, and to the extent that you've got, big specialty retailers that are good at doing that kind of stuff, I'm thinking of Amazon and Walmart and what have you, it would be, probably behoove the retailers to invest in people that can keep that connection as their shoppers might leave the store and consider going somewhere else.
So, Annette, during COVID-19, what roles have the retail dietitian been playing, both on a corporate level? Do they have any involvement with corporate?
Yeah, and Phil, you and I, in a conversation yesterday, we're talking about, has the dietitian at retail become the chief nutrition officer and the chief health officer? And I think in some regards they have. And so I think that corporate executives are relying on them a lot more, both on the shopper side and on the employee side, to say, how do we keep our employees safe? How do we manage some of these issues? But also on the shopper side, how do we continue to engage that shopper who has health and wellness needs, but understanding the differences that the coronavirus pandemic brings to those areas? And so I think we're seeing a lot more of that advising, that consultation to their internal leadership, to HR departments. I think communications teams and marketing teams are struggling with, how do we communicate this in a shopper-friendly way, right? And what do we choose to communicate versus what do we not communicate? And the cadence of that communication is crucially important. And I see dietitians have really stepped up in those capacities to help their retailers.
So are they being listened to from a science standpoint or a communication standpoint? Because, clearly there's a lot of mixed messages out there,
Uh-huh.
um, coming from whether it's CDC or UFCW or whoever, the White House, and so on. So are the chains really relying on the retail dietitians to filter that information and get them, the correct information, or is that just being handled by government affairs and legal?
I think it's a balance of both. I think, Phil, you're probably aware many retailers are actually doing daily kind of executive meetings on coronavirus, and, everything changes daily in some regard. And so they have daily calls in many situations. And I know several of the corporate level dietitians who are involved in those meetings and participating in those meetings, providing their advice and guidance along the way.
So back to John's point that health and wellness becomes even more important. Same thing that you've
Uh-huh.
said, Annette, Jen, Kat. How are we going to communicate? And this is a question to all. How are we going to communicate the importance of health and wellness to consumers beyond what's being done today?
Well, I mean, one of the things I was flashing on when you're talking about that is, a very big issue right now, which is, getting coronavirus testing done, and some of that stuff. And you've got, Walmart and Kroger for two good examples of retailers that are, participating by donating their parking lots for and their pharmacists for testing efforts that are going on there. Amazon's made a big a deal about it, even putting some workers to work, trying to find a cure. I mean, this. So yeah, one of the legacies of the of this crisis now, I think, is going to be a sort of a tighter tie between food and health, and food retailers and health, and obviously Walmart and Amazon among them, that are playing as hard in the healthcare field now as it would appear in the food field.
Jen, do you think that just the same way we've seen testing for diabetes in supermarkets and other screenings, do you think we're going to see COVID-19 testing in supermarkets for consumers?
I mean, perhaps. I mean, my supermarket that I could, throw a rock and hit, does flu
Don't
shots.
throw rocks at your supermarket.
So if they're already offering flu shots and that kind of thing, I mean, why, a lot of them have, clinics, and I absolutely could see that being part of it. And I was just going to say on the, the retail dietitian piece, like making sure that they're still part of the conversation as, so much shopping moves online, and maybe there are already grocers doing this, but, maybe the retail dietitians do a curated bag of groceries that, it's an immune boosting bag or a mood boosting bag of, these are ingredients with recipes that, you can make this week to feel better, and get the retail dietitians more involved in having a say in e-commerce.
So as John in our last episode talked about with HelloFresh and all the boom in store meal kits as well as out of store meal kits, Annette, do you think that we're going to see more retail dietitians getting involved with meal kits that are being sold and produced in store?
Yeah, and Phil, I think, and Coburn's really has led the effort on healthier meal kits, right? So in a lot of retail situations, we see that meal kits are traditionally created by chefs that aren't necessarily paying attention to the nutrient profile of those meals. But Coburn's was the first retailer several years ago now to really have their dietitians put their stamp of approval on specific meal kits. I know that HEB has done a lot of work in that area, and I do think that will continue to evolve, just because of the need and because consumers will feel more safe with that idea of a meal kit, but knowing that it's curated to meet their health needs, and that it specifically addresses their health concerns.
Before COVID-19, we started to see a lot of retail dietitians working in store with the culinarians to do in-store demos and to your point, healthier offerings. For the entire panel, do we think that in-store demos after COVID-19 are dead?
They're
You know,
probably not going to be
yeah, go
as
ahead, John.
they once were. Let's put it that way. I mean, I'm sure that, listen, the clever retailers and brands that are very motivated are going to figure out a way to do it in a way that's safe. And I think that's what we'll see. So,
But the only thing that I've seen, I mean, especially in cheese departments, is they've got that goofy clear plastic thing that you then can turn, and you can still put your hand in there and get a piece of cheese. Are we going to get beyond those kinds of solutions to smarter solutions?
I think, Phil, and I was on a call the other day with a couple of the corporate dietitians at Albertsons, and we were talking about this idea of, do demos come back from a health perspective? But we talked about that maybe now it's truly demos and it isn't sampling tied to it. So we know that consumers and shoppers, their cooking skills could all be improved, right? And so it might be more around demoing specific skills, or, the very simple example of what's the best way to cut a mango, right? But it might be more around demoing skills, demoing simple recipes, but there isn't a tasting component of it, which changes it significantly, right? Because it isn't the same experience that the shopper has been used to.
And what about the social distancing? If you're doing a demo now in a supermarket, you might have a dozen people standing shoulder to shoulder, watching the demo. Are they going to have to be 6 foot apart? And that, makes it even more complicated.
I think you can, I've one of, I think it's Star Market's new stores has all of these television screens around the store. And I was just thinking, that's a great way they're using it to promote other departments. But if you had a cooking demo, you could easily, if you were set up for that, televise that throughout the store so that people could still participate, but social distance.
Yeah, ShopRite does that a lot too, where they've got these monitors throughout the store and they're pre-recorded, but that doesn't mean that they couldn't be live. Great point, Jen. Annette, you were going to say something? Sorry.
No, I agree. I think it's a good point. One of the examples, Phil, Hy-Vee has a video program called Substitute Teacher, and it's the idea of they substitute one healthier ingredient in a recipe. And so that's an example of something, while they're doing it via video right now, but those could be done live. It's a great opportunity for the shopper to make one simple change. And those are the kinds of things that I think we're seeing dietitians really pivot to how do we help the shopper? How do we make it simpler? But you could do those kinds of things with a live video, and then questions could be monitored somehow live.
And let me move to another part of the store and the impact of health and wellness. Grocerants. We've seen a lot of supermarkets put in grocerants in the past couple of years. Food service has become more important. How are we going to balance what a grocerant was with what a grocerant needs to be? Certainly, they've got to take out a lot of tables, the social distancing. But what about the health and wellness? And Kat in Chicago, Mariano's really was built on this concept. Do you see that changing at all?
I think it depends. Restaurants are starting to open up in certain states. So I think it depends on what we're starting to see there, whether consumers will come back. I think they feel safe in supermarkets right now. So if they had the option to go and eat a ready prepared meal in a supermarket, they likely will return. But I think, I just think so much is up in the air right now that we really just don't know. I know Jenn has been working on our retail food service report. I don't know if she has any insights yet on what Technomic is looking at happening in the next year or so.
Yeah, Jenn, give us the inside scoop.
Yeah, I wish I could. I don't have access. I haven't accessed that data yet, so we're too in the early stages of that. But I think I think it's going to take some time for the grocerant concept to come back. now we're all trained to get in and out of the grocery store as quickly as possible. And, I'm uncomfortable, of course I'm wearing a mask, but it's uncomfortable. It's really hot and you're just trying to
hurts your ears.
get in and out. And,
Yeah.
So the idea of, suddenly things open back up and people are lingering in the in-store cafe, I think that's going to take some time.
And Annette, what role do you see the retail dietitian playing in the reopening of restaurants? Are they going to get more involved with those menus? I know Gelson's, for example, their retail dietitian is heavily involved with what their food service offerings are. Are we going to see that increase, or is the retail dietitian just going to be so busy after COVID-19 that they're not going to have time for that?
Yeah, I mean, I think as you look at the total store, they'll continue to be involved in those areas and it might increase. One of the things that we haven't talked about today, Phil, is the whole issue around weight gain. Of we're seeing people, because they're home, they're baking more. And I think coming out of this, to your point, grocerants is an area where consumers are getting tired of cooking at home. They have recipe fatigue. So they're going to want something prepared by somebody else. But knowing they're coming out of this perhaps 5 or 10 pounds heavier, they're going to want some things that are designed to help them more effectively manage their weight moving forward. And so I think that's a particular area in grocerant, that could be a great synergy between those chefs and the dietitians for sure.
And we've talked here before about that whole in-home baking, in-home cooking, and we've called that COVID-19, like the freshman 15, the COVID-19 weight gain.
Exactly.
Well, thank you all for joining us, Annette. Thank you for joining us today. Don't forget that all of COVID-19 Facebook Live from Winsight Grocery Business is on Winsight Grocery Business Facebook page, on the website, and on Supermarket Guru Facebook page, and on supermarketguru.com. And we will be back Tuesday at 9:30 and next Thursday at 9:30 Pacific time, 12:30 Eastern time as well. And be safe and be happy and be healthy.